All right. Once again, good evening, everyone. So today we finished module 1, we are on module 2. And in this course, we basically have 4 modules to cover. But each of the modules has a lot of units under them, like module 2, for instance, has like 6 units under it. And last week we covered unit 1 and 2. And today, still under module 2, we are still going to cover unit 3 and unit 4, which is titled occupational accidents and occupational poison. Those are the 2 units that we're going to be covering this afternoon in the next few minutes that we are going to be interacting together. And I also want to let you know that I crave your contribution. And like I always say, that this is student-centered learning. This is not teacher-centered learning. In teacher-centered learning, teachers lecture, but I am not a lecturer. I am to facilitate because it is student-centered learning. You are to talk back to me. You are to interact with me, and I'm to facilitate this class. So bear in mind that you will be doing the talking more than I do. Okay. So, but before we dive deep into the class, into the lesson, let me quickly share the learning goal, the learning objective, or the learning goals for this particular unit, for these 2 units that we are going to be covering. Because at the end of today's learning, today's interaction, learners should be able to define what occupational accident is. And you need to take note of it and understand it, because these are things that you will come across during your exams. Define occupational accident, define occupational poison, and not only be able to define it, you should be able to know and state and describe different types of occupational accidents that occur at work environment. Not only that, learners should be able to describe the predisposing factors to occupational accidents, explain methods of prevention and control of occupational accidents, describe the management of accident cases in occupational settings, describe the occupational poisons and their sources. And lastly, learners should be able to state prevention strategies for employees. So those are the 6 learning goals or learning objectives for Unit 2 and Unit 3 that we'll be covering. Don't forget, I said that Unit 3 title is Occupational Accident, while Unit 4 title is Occupational Health Poison. Those are the 2 things, the 2 units that we'll be covering shortly. So talk back to me. What do you understand by occupational health accidents? What do you understand by occupational accident? Wasilat, you are welcome to share your thoughts. Yeah, you can unmute yourself and speak.
Good evening, ma. I actually wanted to say that Unit 5 is occupational poison.
Okay, okay.
While Unit 4 is occupational radiation and cancers.
Okay.
So there is a mix of that. So I want to be sure which one we are doing now, if it's radiation or occupational accident and occupational poison.
Okay, we are actually doing, pardon me for the misplacement, we are doing occupational accident and occupational poison.
Okay, maybe I should just try occupational hazard. Occupational hazard refers to occupational accident refers to accident that happens during work in a workplace. Might be a fall as a
Okay.
result of slippery floor. It might be as a result, it might be caught as a result of sharp instruments that
Okay.
one is using in the workplace.
Okay. Okay. Yeah. That's why it is called an accident, because you don't plan to fall, but due to
And it can
something.
be a puncture as well from
Yes.
theory
Yes.
that need medical treatment. Thank you, man.
Yes.
That's what I can say for now.
All right. Thank you very much. That's a brilliant contribution. Yes, that is why it is called an accident, because if you had seen it, you would have prevented it and the accident wouldn't have occurred. So those are the things, and these things happened in workplaces. Yeah, it can even be a machine. Someone that is operating a machine accidentally places end where it ought, or where he or she ought not to place it, and it gets an accident or accident occurred. So that's that. And just like you have said, that accident occurs, and most of the time it becomes a threat to the workers, to the employees. Yeah. And it it becomes a costly situation, because due to this accident, no, the duty of the person now is altered. Both the employers and the employee is suffering, because the output for that day will be reduced, because one employer is short, is affected. So those are the things, those are the challenges that comes with accidents. So we are going to look at different types of. Okay, before we even look at types of occupational accidents, we've said that occupational accidents are they are unanticipated. You don't anticipate it, that you're going to fall, or you're going to get cut, or you're going to get punctured, depending on your area of work. So, and because of that, it causes not only economic challenges, but it also causes human and material losses, both in terms of pay and not pay, because the individual now is having pain, is not able to go to work, and things are not the way it should be. And so, what are the types of occupational accidents? The common types that we have, what are they? What are the common types of occupational accidents? Ibrahim, you want to try? Okay. Let's still hear your thought, Wasilat.
Like I said earlier on, my workplace, puncture,
Okay.
one of the common things in workplace. And if it's a company where chemicals are being made, once the chemical poured on somebody, that part of the body can be chopped off.
Okay.
It can cause scarred. Scarred is one of it. Crush injury in a company where heavy machines are being used.
Okay.
If it's in an hospital settings, like I said, needle puncture of an infected patient with either hepatitis or HIV to the health workers.
Okay. 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 And don't forget, earlier you also mentioned fall.
Fall,
Yeah.
yes.
Yes.
As a result of slippery floor.
Yeah, not only that, what about those working in construction company?
Companies.
Yeah.
Then fracture
Okay.
from fall or sprain from fall.
Yeah.
So all these things can happen, are common things in the workplace.
Yeah. Yeah. Yes, you are right.
That's what I can add for now.
Yeah, we should also think broad. What about those who are drivers? What are those accidents that can happen to them because that's their job? Motor accident is an accident.
Yeah, they can have an accident and they have a loss of either hand, any of the
Mm-hmm.
limbs, upper
Mm-hmm.
or lower limbs, which can
Yeah.
affect them for life,
Yeah.
can make them useless, so to say, because they won't be able to drive again, and it
Mm-hmm.
will affect their livelihood, source
Mm-hmm.
of income, possibly their satisfaction in life,
Yeah.
unless they have to go and join another work where probably they have to, I don't know. So that's that as far.
Yes, yes, you are correct. All the points that has been mentioned are correct. Now, the next point I want us to discuss is the predisposing factors to this accident. One way or the other, you mentioned it earlier, but let's streamline it now. Let's be more specific. The things that can trigger when they say something is a predisposing factor, that is, it can cause or can lead to this case. So let's mention or let's share our thoughts or our ideas on the predisposing factors of accidents. Some of the causes are well known, while others are not known. So the known one are what?
The known one are the main causes.
Okay, let's mention the known one when you talk of unsafe human behavior. Imagine you are working with a colleague and the person split water or splash water, I mean, on the floor. The wisest things to do is to mop it immediately he or she notice that, oh, water has been splashed on the floor. But when the person's, because of his behavior, nonchalant or untidiness, leaves the water, another fellow comes there or another worker unknowingly sleep. So these are the things, unsafe human behaviors or human failure. When you know the right thing to do, fail not to do it, it's also a problem. I can see Ogutele's and your electronic hand is up. Let's hear your thoughts.
Yes, ma. I also want to say that poor working conditions like poor lighting could be a cause.
Okay.
Faulty machinery, like machines that are due for servicing, they were not being serviced, they could
Mm-hmm.
pose danger.
Yes.
Um, Lack of protective wares or equipment
Mm-hmm.
could also be a predisposing factor.
Yes.
The worker's health, peradventure someone who is sick and is taking medications and is to operate a machine could be at risk of an accident at work.
Mm-hmm.
I think
Yeah.
those are the few I can remember for now.
Okay. Thank you. Thank you so much for that contribution. You are right. You are right. And you see, most of the time, you can lower your hand now. Most of the time, the employers provide these protective gadgets, but because of the unsafe behavior of employees, they do not use it. So those are the things. The environment, yes, and that is why as we progress in this study, to now understand the importance of pre-medical examination. You will see the importance of it, why it is important to do a pre-medical examination so as to know where to place an individual, someone who is already having an underlying medical problem, and is on sedative medication, if it is discovered on employment before the person commences, the employer will know that such a person should not be put in a production department. That such a person should not be put where machines needs to be operated, and so on and so forth. So the next point, or the next thing we want to look, we've unpacked this on human behavior, on predisposing factors. We've unpacked it. We don't need to repeat ourselves again. What are the ways we can prevent occupational health? Prevention and control of occupational health. What are the ways? You see, these things are interwoven. So it means, okay.
Ways we
All right.
can prevent occupational, accidents
Accidents.
is we have a pre-employment checkup, medical checkup.
Okay.
The use of protective gadgets.
Okay.
Then, like all the machineries that the workers are using, the employer should make sure, or the engineer in charge of them should make sure that everything is working perfectly well.
Okay. Okay. Okay.
Then the workers should be provided with adequate things they need to work with.
Agreed. Yes.
That's
yes.
what I can remember for now, ma.
Okay. Thank you. And don't also forget the space, the working space, and that is why for those of us who are okay, no, this is 500 level. I don't think we will have public health students in our midst. Okay, and that is why those of us that we are managers or we are supervisors, in our different hospitals where we are working in companies, we need to allow for our subordinates who are working under us, if they say they are not feeling fine, let's not force them to work. Because if someone is not feeling fine, the person needs to take time to rest, and you force the person to come to work, that means the person is not operating at its maximum, and the person is likely to make mistake. So also, and that is why, thank God for nurses, when you do 7 days of night, you have night rest, you have night off, night off. That is to say, the management understand that no, you've stretched yourself for this number of days, then you need time to be able to rest so that you can refire when you resume the afternoon shift. All right, so the next point we also want to look at now is the management. How do we manage occupational accidents? Management of occupational accidents. It is important to know that accident victim should be carefully managed. When I say carefully managed, that is, you provide what we call first aid. First aid should be given by occupational health nurse. And you're giving this first aid treatment while waiting for professional ambulance, or while waiting for ambulance or rescue team to arrive on the spot to convey this victim to the nearest hospital. And what are the things you do? Never move an accident victim until his breathing has become adequate. Very, very important. Or until his bleeding has been controlled, unless the victim life will be in further danger. When you have a victim in industry, wherever, you don't move them until you stabilize certain things, their breathing and their breathing and their bleeding. Very, very important. Except if you see that their life will be in further danger, that is when you move them. And another thing in managing an accident cases is when you are lifting or you are carrying an accident victim, you do that gently with support from the head, the neck, and the back, as well as the extremity. You don't just lift. I feel that as nurses, professional nurses, we know better on that. So that is units, that is occupational accident that we've just covered. Is there any clarification? Is there any contribution or any question on that before we move to occupational poison? I crave your contribution, okay? Without you, I won't be here. Ogunkunle, you may speak.
Yes, ma. I also want to say that proper orientation will go a long way.
Okay.
When a new employer is coming to the system, the person should be told what to expect, how to protect his or herself from accidents, and proper orientation on protective wears to prevent possible accidents.
Yeah.
And also a record should be available to trace accidents and their possible outcome.
Okay, what do you mean by record to trace possible outcome?
Yes, I think if there is a record that, because at times when you tell people that do this, wear an helmet if you are going to the working site, say, has there ever been any issue like that? But they can, when they see a record that, something like this actually happened at some time, they will be more conscious of it. There is a possibility than a tale.
Okay, no, you are right. You are right. Yes, you are right. So I think as we progress in this course, we will see the role of employers and the role and the responsibility of the employee. We all have our roles to play. The employees knows that what they must do, and the employer also have their role. So, which I think in the future in this course we would learn it more. So it's important. That's a good point that you brought up. So we go to the next unit, occupational health poison. Occupational health poison. And so when we say occupational health poison, what comes to your mind? What comes to your mind when you hear the word occupational hazard? Let me just put it like that. Okay, you're welcome to share your thoughts.
Yes, ma. Occupational poison can be in different form.
Okay.
In a workplace where chemicals are being made, if a worker inhale such chemicals like where carbon monoxide are being, has been expelled out in a larger quantity and workers are there and they inhale it, this can affect their respiratory system.
Okay.
And if care is not taken, they can go into unconsciousness because of the CO2 narcotic.
Yeah.
Then another one is probably mistakenly if or food of a worker and he or she doesn't know, which can impair organ. Those are poison. Or don't let me even go there. The food we eat at home can be contaminated by some microorganisms. So after eating, an individual can have running stomach and start going to toilet, and from there vomiting thereafter to the hospital. Occupational poison is something that is taken into the system that affect the functionality of the whole body. Thank you,
Okay.
ma'am.
All right. Thank you very much for that definition. That's occupational poison is a substance. Yes, it's a substance which most of the time comes in a chemical form, and it's affect when it is injected or inhaled, because you can either inject or inhale it. So it affects the function of the body. Yeah, thank you very much. We also have different source of industrial poisons. You partially mentioned melters, chemicals, and acid. I'm not sure if you mentioned strong acid, even dust. Many people do not know that dust is poison. Yeah, if you inhale dust, you can start having respiratory problem, gas, fumes. These are poisons to the body. So it's important that when we come across Mugani KG, your hand is still up. You have something to share?
Oh, sorry, ma'am. Sorry, nothing, ma'am.
Okay,
Mistake.
all right, noted. So those are the things, those are the the substances that, okay. Kalu Grace, you said you cannot hear. Please check your volume, because I want to believe that every other audience, as in my audience, can hear me audibly, right? Am I audible enough?
Yes, ma'am.
Yes, ma. Yes,
Yes,
ma.
ma'am. We can
Yeah,
hear
please.
you.
Yes, Kalu, please check your device to check for the volume. The problem must be from your hand, not here. Thank you for letting me know anyway. So those are the things, these are the places that when you see it, and as nurses, when we see people that are working where all these things are emanating from, it is our responsibility, even if we are not employed as occupational health nurses there, to educate them, to let them know the danger they are putting themselves by not protecting their nose for those who are working where there is dust. An example that I can give you, when I'm walking or when I'm driving past and I see people, especially back home in Nigeria, and I see people who clean, the community, and they are sweeping a very dusty area, and I don't see them with face masks. Sometimes I take the pain to walk up to them and educate them, because they might not know. Because at the end of the day, this person do it today, tomorrow, the next thing the person will start coughing, the person will start sneezing, the person will start having flu, not knowing that it is the job that he or she is doing that is predisposing him or her to these challenges that is having. So it's important. Please drop your number here. Okay. Yeah. So there is a message here that we are to drop your number to be added to the group. Yes, please kindly do that. We have a WhatsApp group where we can communicate during the weeks, over the weekend, ask questions and see if you can get help. Please, you're welcome to join we appreciate Mureni KG Wasilat for agreeing to be the class rep, for taking that responsibility. Let's appreciate her and let's not frustrate her effort. Let's cooperate with her. And I also want to say that I'm hoping that we'll finish this facilitation before the 8th week. That actually our 8th week, or one of this Sunday before the 8th week, we can have it to kind of have a kind of question and answer, and in preparation for exam, we just ask questions and we interact more. or ask question or clarification on what we do not understand, so that nobody is left behind. Okay, but if I'm scheduling any meeting outside the normal Thursday class, I will definitely let you know and post it on the group. Okay. All right. So as I was saying that people needs to be educated. People needs to be empowered with knowledge on what predispose them to disease, or how they can prevent occupational hazard or occupational poison. An example is what I just gave you. People don't know that dust is a terrible thing and it can cause problem to their health. What are the strategies for prevention? So let me just quickly share my slide with you on strategies to prevent occupational health poison. And I have on the screen here one, just like Ogunkunle mentioned, that there is need to conduct a pre-employment and pre-placement health assessment. And why that is important is you want to be able to know where to place a candidate or an employee after employing the person, by when you have understanding of the health condition of the person. So, and you want to also monitor health status of the employees from time to time, at least every three months. If you are working in an industry, you need to go for a medical checkup to be able to know if you are still maintaining your health, and also for you to be able, okay, let me even ask, why is it important? Why is it important to do a periodic medical examination? Let me hear your thoughts on that. Learners. Okay, you can speak.
It's actually to detect early in case there is any illness or any deformity going on in the system, which can be.
Okay, I think she's having network problem now. We can't hear you.
Becoming degenerative.
Okay, don't forget that.
I said it's to detect early. And hello, ma. Hello, house.
Yes, yes, we can hear you now.
Yes, I said it's to detect early any abnormality or any hidden illness in a worker.
Yes.
So as to address it in good time
Early.
before becoming degenerative.
Yes, yes, that is it. That is it. Because if you are working in a unit and that unit probably is a production unit and they're using chemicals there, if you are not doing, or if the employers are not sending the employees for periodic medical checkup, they wouldn't know if that unit is predisposing that employees uh, problem to the health of that person. But by doing periodic medical examination, now they can say, oh, no, this person was not having a respiratory distress when we employed her, or when he was working in a package department, or when he was working in the infection control, or when he was working in medical surgical ward, or when he was working with in the medical ward. But since we moved the person to accident and emergency unit, this nurse or this person is now having serious problem on this, on that. So we've seen the important. Another thing, another strategy is effective supervision. Yes. No, supervisors are not put in a unit just for the fun of it. They are put there so that they can effectively inspect if things are done the way they should be done. And if employees are doing their part and complying to the rules and regulations guiding that unit. And the next point is continuous training on the actual work situation. And lastly, to monitor the use of protective devices among the employees. So we are gradually coming to the end of this class. Dr. Malomo, I'm in class. So, as I was saying, that occupational poison can cause disability, like Keji mentioned. Not only disability, it can also cause psychological depression, trauma, and economic loss because the person keeps spending and spending, and the implication is on the employees. Am I seeing your hand up, Wasilat?
No, ma.
Okay, your electronic hand is still up then. Okay, so in conclusion, on this unit, we've understand that occupational accident is unforeseen circumstances. And not only that, we've also seen that occupational poisoning is one of the hazard workers are exposed to. And unless safety are consciously inculcated into the mind of workers, there will be continuous carelessness arising from both parties, which could lead to permanent disability or even loss of life among workers because of what? The effect of these accidents and poisons are for years. They take years, sometimes even to manifest. Therefore, it is imperative to train workers to abide to all the safety measures provided to them. So, thank you all for joining today's class. I know out of your busy schedule, you've made out time to join this class, and I really want to appreciate. I can see some are even still on the road and you're trying to connect. So at this junction, I want to welcome contribution. I want to welcome question. If you have any clarification, if you have any question, you are welcome to do so now before we end this class. And also note that you can ask questions from what we have learned so far from our WhatsApp group. That is the purpose of the WhatsApp, for us to continue to engage. Any question, any contribution? For those of us who contributed, thank you so much. Thank you so much. Any question? Is there anything that you feel that you need clarification?
Thank you, ma. Please, ma, I want to ask that, especially as health workers, at times you see that mental stress is also one of the hazards that someone is exposed to. Can we say is a part of occupational health hazards?
Yes, it is. Why did I say so? No, there are a lot of things that causes stress to an individual. Take for instance, a secretary that has a boss that is abusive. Do you think that secretary will be happy every day to go to work? Each time you remember, it's another day to go to work. It's stress. True or false? So mental stress is a big thing.
True.
Is this an occupational health problem? Not only the boss, some of us are colleagues. Some of us works with colleagues that are very terrible and difficult to relate with. And I remember when I was still practicing as a clinical nurse, you don't want to be peer or you don't want to be on duty with certain individuals because working with them is like hell. You get? So when you work in an environment that's either the people or the work stresses you, it means that each time you're on duty or you're with the person, you get traumatized emotionally, you get stressed. And imagine if you have to do that work for 10 years, you carry the stress. So, except if any of the class member have other view to the question, but to me, I feel that mental stress is occupational health problem as well. Who else wants to? Okay, we are still reminded. If I hope Ogunkule, I hope I've been able to answer your question.
Yes,
Don't
ma'am.
forget. Okay, thank you. Don't forget to drop your number, so that we can add you to the WhatsApp. And I'm also going to post the WhatsApp link to the school page, so you can also join via that. So if there is no question, if there is no further question or contribution, this is where we are going to end it for today. I'll see you next week, same time. Have a blessed good evening. Bye.
Thank you, ma. God bless you.
Thank
Interactive
you, ma'am.
class.
All right.